Hey everyone, my name is Sienna Boyd and I am in the Choose Health studio with Hillary Avera, who is our physician assistant at our pediatric office here. And so today we're going to be talking about screen time. I know that can be kind of a controversial subject. It's come up over the past couple years just because we have so much more technology, screens are everywhere. So we just wanted to touch on that, talk to an actual professional about best practices. So first things first, can you just introduce yourself, tell us about your practice, and then we'll go from there.
Yes, my name is Hillary Avera, like you said, and I work at our pediatric location, which is off of Margarita, across from Macaroni Grill in Temecula. So we see patients, newborns, 3-4 days old, which is great, and we enjoy seeing patients that are 18 and sometimes up to 21 years old as well.
Oh wow, that's awesome. That's good to know. So as we're talking about screen time, can you tell us, first define what screen time is? What does that look like?
So for screen time, the definition is pretty simple. As far as our pediatric patients go, it's any time that they're spending in front of a device, whether it be an iPad or a tablet, whether they're watching TV, even educational apps on a cell phone.
That still counts as screen time?
Still counts. Okay. Social media does too, especially for our older patients that have Instagram or Facebook.
Okay.
YouTube, video games is a big one as well. All of that is encompassed under screen time.
Underneath that umbrella. So as we are seeing an influx in the amount of time our students and our kids are spending on screen, what are some of the statistics that we're seeing of how much time they're actually spending?
Well, one statistic that still shocks me is back in 2016, the AAP, American Academy of Pediatrics, published an article in which they stated that back in 2016, the average child was spending about 7 hours a day on the screen.
7 hours?
Yes.
Okay, that is shocking. That is, so if an average kid is spending, 12 hours of their day awake, then 7 of those are on a screen?
Yes.
That is wild.
And of course, it's more so a challenge now, especially as school and other types of programs go to more of an online platform.
Oh, I bet. Oh my goodness. So what kinds of pros and cons are we seeing? Because I know there can be pros, but I know maybe some of the cons may outweigh the pros. So tell us a little bit about that.
So right now, especially, several of our patients of all different age groups are actually using things like FaceTime or even chatting with their family members and friends and kind of trying to stay connected as much as possible through FaceTime and just trying to see their relatives since they are trying to practice social distancing.
Sure.
So that's definitely a benefit for some of our patients. However, things like that really don't take the place of actually having peer-to-peer interaction where you can learn to model your peers and see other behaviors that your peers are doing. And it also doesn't replace the time that you would spend face-to-face, making eye contact, helping with vocabulary development, just by being around your friends and family in person.
Definitely. Do you feel that there is some delay in development if they are spending too much time on their screens?
Yes, there's 3 major issues with having too much screen time in a pediatric patient. So one of the big things that I always try to touch on with our patients is that the more screen time that a child spends, in fact, every hour per week that a child spends on a screen, it increases the chances that their BMI is going to be in the percentile where they are overweight or are experiencing childhood obesity.
Wow.
With that being said, when a child spends a large amount of time on the screen, and especially if they're snacking while they watch that movie, which is fine occasionally, or they're playing video games throughout the day, the part of the brain in a pediatric patient that tells them that they are full, that part can be suppressed a little bit when they're overstimulated by a device.
Wow.
So that's one of the big issues. Typically, it's a more sedentary lifestyle as well.
Definitely.
If they're spending time sitting playing the game. So that's another issue with the obesity risk factor. Another thing that we see in our office too is that sometimes there's increased complaints about insomnia, difficulty falling asleep, or getting quality sleep too.
I bet, because I bet they're spending time on their devices right before bed. Okay, I mean, I know I do, which is probably not best practices.
It's okay. Even as an adult, I'm guilty of that too. We just try to educate our patients and our family members on trying to kind of mitigate that and develop healthy habits. So we typically recommend eliminating screen time or minimizing it 1 to 2 hours before bedtime. The blue light on a lot of the devices too, it actually causes a suppression in melatonin and throws off the hormones in children that they need to know when it's time to sleep and when it's time to wake up.
Wow. Oh my goodness, that's so interesting.
Yes, and then one of the other things too, especially in our younger patients, but it's patients of all ages in pediatrics as well, is that there is social or cognitive delay that can happen.
Wow.
Typically, the more time a child spends on a screen, again, none of us are perfect parents, but that typically means, that the parent might spend a little more time on their device too.
Okay.
So that's less interaction where they're having that hands-on three-dimensional learning experience with their child.
Right.
And there's less vocabulary exchange for the child too, less time for them to be imaginative if they're on a device.
Oh my
Our
gosh.
older female patients and male patients are also at risk for developing anxiety and depression associated with increased screen time. And just one other thing to mention there too is that for some of our older patients that maybe they do have the privilege of having an Instagram, a Snapchat, or Facebook, very popular these days. Those actually can give our patients a false sense of reality.
Okay.
It does increase the chances in some patients that they might actually participate in behaviors that otherwise they may not if they weren't seeing it or feeling as if other patients, like everyone else in their grade, is doing it too, which is really a false sense of reality, and we want to typically avoid some of those behaviors.
Definitely. I know you had touched previously on how all people are having issues with, or all children are having issues with figuring out the best times to be on the screen. I know screens are everywhere. You mentioned video games, Instagram, phones, tablets, TV, all of that. So it's kind of unavoidable. In that case, are there recommendations on how much screen time children should be having, or a limit on how much they should have?
Yes, that's a great question. So the guidelines have shifted over the last couple of years, but ideally if your child is under 2 years old, it's to try your best to eliminate all screen time for that age group. They have had some studies that have said, FaceTime, and if it's something where the adult is right next to the 15 or 18-month-old and is able to sit there and kind of explain to the younger patient what they are seeing or experiencing in a two-dimensional world, that in some cases can be appropriate. Between the ages of 2 and 5, the recommendation used to be 2 hours of screen time a day. It now is to get 1 hour or less of screen time if you're 2 to 5.
Wow, that's a big jump from being 2 hours till even less than 1 if you can.
Yes.
Okay, wow.
And again, no one's perfect, but it's just trying to minimize it as much as possible. And then another thing is for our patients that are 6 and older, ideally to keep it less than 2 hours of screen time a day. So just do your best to try to eliminate it where you can.
Okay, that is very interesting. Now I know a lot of us are doing distance learning now, especially in California. We have distance learning in specific counties, which means that a lot of our students are doing learning online on a screen the whole day. So how do we mitigate those cons we were talking about when students have to be on the screen?
So one of the big issues, if you're going to choose between an ebook or an iPad or a tablet, preferably choose a device that you can turn the blue light off on the device.
Oh, okay. I didn't know that was an option. So very interesting.
Yes, look under the settings on a lot of the devices. You can turn that off. Or on Amazon, you can get a non-prescription pair of Blue Shield glasses.
Yes.
The reason I recommend that for a lot of our patients is because the blue light can dry out the part of the eye that helps to keep it moist and oiled. So we want to make sure that we don't do that prematurely, especially in a pediatric patient. It can cause frequent blinking and other eye problems later on. So try to do that if you can. Ebooks, I can see that where the benefit is with the ebooks, but ideally if you have an ebook with your child, still you're participating in the book with the patient and kind of emphasizing those parts of the lines that should be emphasized, acting out roles, still asking them, okay, where do you see the bunny rabbit? Can you point to this? So you still get that one-on-one interaction with your child, and that will help them take what they're seeing on the device and implement it into their world.
Wow, that is great advice. I know we had talked about our kids now having different devices they can watch and play. Do you have recommendations for apps they can use, shows they can watch, that if they do have screen time, it's a better option?
Yes, so especially for our younger patient population, remember 2 to 5, they can get that 1 hour screen time a
Sure.
day. If they are going to be on a device, we recommend to our patients to check out Common Sense Media, PBS Kids. They have an online platform as well as an app, and there's Sesame Workshop. So why we recommend those applications is because those are actually applications and programs that have been tested on that population and actually have been proven for the patient to be able to do whatever touch interaction on the screen and then actually relay that back onto paper or verbally show that they gain knowledge using those apps. So ideally, something that is an app that's already been trialed on kids and proven to be effective.
So it is educational. They are taking even what they're learning on the device or on TV, and they can put a pen to paper and say that they've returned that knowledge or retained that knowledge.
Yep.
That's pretty awesome. I know oftentimes we can use screens or devices to calm a child or to distract them, whether maybe we're in restaurants or on a car ride or anything like that. Those are things I've seen. Is that an okay practice? Is that something we should try to mitigate?
So I do have a 2-year-old myself, and I know there's definitely times where it's tempting, and things like if they're going to have a medical procedure, a dental procedure, or something to help keep them calm, reduce some of the anxiety, it can be appropriate in those cases.
Definitely.
Generally speaking, you want to try to avoid making a habit out of that.
Okay.
One, growing up, for instance, me and you, we didn't have as much access to devices, and it was a good thing for us to experience those emotions and kind of work through self-regulating our emotions. So when you have this great tool in your toolbox to give them a device, since it is effective in calming a lot of our pediatric patients down, in the long term, it's really not an effective way for them to manage their emotions, understand their emotions, and it also causes difficulty as they continue to grow and develop in setting limits for your child.
Interesting. Can you touch a little bit more on managing emotions? So you said that it may hinder that. So can you give us an example of being able to manage their emotions with screen time, and then what it may impede if they're having screen time?
Yes. So for example, if your child is having a tantrum or they are getting either kind of acting out, especially in public when it's like you want to just hand them the phone. Ideally, you more so justify that feeling and label that feeling directly with the child. Like, I see that you're feeling angry or you're upset right now, and let them, if they're going to be upset and throw a tantrum, go ahead and let them work through that and process that on their own. And then set limits for them and expectations that instead of them getting more emotional and louder until they get the device, there's actually going to be a punishment such as a timeout if they continue with the negative behavior.
As opposed to just giving them the device and not letting them work through those anger emotions and learn how to calm themselves down. You calm them with a device. Okay, that's interesting.
And then just overall usage with screen time too, like we had mentioned, turning off the blue light on some of the devices. We do encourage patients also to go to American Academy of Pediatrics, their sister website, which is healthychildren.org. There is a family media plan that you can customize and create for your own family. And it just offers suggestions to families such as no media or screen time in certain areas of the house, like the child's room, no media or blue light devices 1 to 2 hours before bedtime, no TV on during mealtime, so that way you can interact with your child. And it helps you kind of have something that you can even print out for your child and put up maybe on the refrigerator and things like that. And it's something to help the whole family work on their total screen time throughout the week.
Interesting. Oh man, those are great recommendations. It's so interesting. Like you said, you and me, we didn't grow up with devices. And so now we're trying to figure out how to regulate that with our children, where that's their reality. So these are such great tools as parents to be able to just help our kids learn best and also mitigate that screen time. So I love that. Thank you so much for being with us, Hillary. We so appreciate it.
Thank you for having me.
Yeah, always.